My name is Margaret Pinnock, and my Capstone project has to do with the challenges of the nursing crisis at Palm Beach Garden Medical Center. I'd like to give credit to Sandria Clark Colstock, RN, BSM, MSN, and our professor, Adino Di Federico Yates. I'd like to deal with the challenges that so greatly plague the healthcare industry, and Palm Beach Garden is no exception. This report will provide an analysis of these challenges and make recommendation based on supporting evidence of how best to solve the problem. Why I make this choice? It's because the nursing shortage affects the hospital ability to provide effective patient care, to recruit and maintain staff nurses, and causes an increase in workload for the remaining staff. Why is the issue important? Why should we care? It's important because we as nurses need to perform effective patient care. We need to maintain healthy lifestyle. With nurses working long hours, it sometimes causes us to feel or suffer from burnt out syndrome and many other health issues. The increase in the patient's deaths and other injuries has been attributed to the nursing shortage. According to JCO, the inadequate nursing staff has contributed to 24% of the 1,609 cases that involve patient death, injuries, and permanent loss of function. Likewise, Wel-don declares that 98,000 deaths each year were due to medical errors. Consequently, the move to improve the safety and quality of care is significant at this time. My problem statement includes the nursing shortage, which has critically compromised the care of patients, those nurses and patients that remain disgruntled, patient satisfaction rate, which is at an all-time low. The shortage is also making it difficult for hospitals to recruit and maintain skilled nursing. Therefore, it is my responsibility to advocate for both nurses and patients to help implement evidence-based interventions that will improve the challenges experienced by the nursing crisis, which include the prevention of death due to the inability to treat patients on a timely manner, the provision of skilled healthcare professionals who can render effective care, and the restoration of overworked nurses and the promotion of nurse retention in my unit. With that said, a list of articles as revealed, there is an inherent need for further research on the subject matter of the nursing shortage in order to find a permanent solution to this issue. Joint Commission on Accreditation of Health Organization talk about the number of patient deaths and injuries. Honor Society states the percentage of healthcare facilities experiencing nursing shortage. The National Council of State Board of Nursing emphasizes the need for change in the way we deliver nursing care. Thus, the issue also needs to be addressed in legislation when dealing with the gap of the nursing crisis. There is a need to institute laws in order to establish a working system to remedy the nursing shortage. As the older population of nurses retire, these policies and laws will ensure that a flow of new nurses will take over. Therefore, it is important that our policy be changed. In addressing the methodology, the design is to express a vision of the organization to which I work by empowering other colleagues to change the current trend. I would first present it to the director of the unit, who will then communicate with the CNO of the hospital in regards to the plan. This plan would first be implemented within my nursing unit as a pilot and then throughout the entire facility. To institute this plan effectively, collaboration with other multidisciplinary team, including managers, physicians, and other heads of department, will be done. Then we'll examine the comprehensive need and the availability of resources for this project. This design is chosen because my goal is multifaceted, and it includes the prevention of death due to tardy treatment and the provision of an high standard of care while minimizing the risk of injury for our nurses. In applying this concept, training programs were established to generate confidence among nurses and provide skills required to enhance effective patient care. Adjustment was made to nursing patient ratio. Flexible work schedules were done to prevent nurses from being overexhausted. Night and weekend incentives and sign-on bonuses was enforced to help in nurses relocation. Working along with the human resources, the multidisciplinary team members collaborated, developed hiring strategies, and provide attractive incentives or benefits package that attract good staff and increase retention. Also, partnering with the local colleges help with the flow of new nurses in the unit. The intervention implemented was evident in promoting change and achieving the desired goal. It was noted that 95% of the participants provided credible evidence that determined the effectiveness of the information, which paved the way for other units to implement this successful approach. It also helped to build relationship among new nurses and allow experienced nurses to utilize the skill to mentor new nurses and facilitate trust. Fewer nurses were now compelled to leave the unit, and an increase in patient and family satisfaction was realized, which improved production, patient care, and nurses recruitment and retention. This was done over a period of 6 months. For future research on this nursing issue, there is a need to expand our knowledge on the current trend in our healthcare facilities in order to improve our own management system. More ideas and information on evidence-based intervention are also needed to help manage or change the current direction of the nursing shortage, and likewise to establish laws that make legislations and policies to create a more permanent solution to the nurses shortage, thus safeguarding the future of the profession. In closing, the demand to end the nursing shortage, the need to provide an immediate resolution is critical. Considerable work is needed. However, the strategies set forth will provide a jumpstart to the nursing shortage. This subsequently will help to improve patient care, increase productivity, and provide the tool necessary to promote nurses as leaders. With this said, I'd like to thank you all for the opportunity of presenting my project.